EP44, signs your thyroid is not working properly after 60, fatigue that no amount of sleep fixes. Weight gain despite eating the same. Feeling cold when everyone around you is comfortable. Constipation, brain fog, depression, thinning hair, dry skin. These are the symptoms of an underactive thyroid, hypothyroidism. And they are among the most commonly dismissed symptoms in older adults because every single one can be attributed to aging, stress, or lifestyle. Thyroid dysfunction is extremely common in older adults, affecting up to 10 to 15% of women and 3 to 5% of men over 60. It is treatable with a once-daily tablet. And yet, a significant proportion of people with thyroid dysfunction remain undiagnosed for years, their quality of life quietly eroded by a correctable condition. Today, we're covering how the thyroid works, the signs of both underactive and overactive thyroid, and what you need to know about getting tested. The thyroid is a butterfly-shaped gland at the base of the neck that produces two hormones, primarily thyroxine, known as T4, and triiodothyronine, known as T3. These hormones regulate the metabolic rate of virtually every cell in the body. They control how fast the heart beats, how efficiently the gut moves, how warm the body runs, how quickly the brain thinks, how actively the hair grows, and how effectively the liver metabolizes fat. The thyroid is essentially the master throttle of the body. Thyroid function is regulated by the hypothalamus and pituitary gland. The pituitary produces thyroid-stimulating hormone, TSH, which signals the thyroid to produce more or less hormone. When the thyroid is underactive, TSH rises. When it is overactive, TSH falls. A single blood test measuring TSH is the primary screening test. Hypothyroidism, insufficient thyroid hormone, is far more common than overactivity, particularly in older adults and in women. The symptoms reflect a slowing of the body's metabolic processes, fatigue and sluggishness, profound, unrefreshing tiredness that is not explained by sleep quality alone. Weight gain, despite unchanged diet, often accompanied by puffiness and water retention. Feeling cold, persistent cold intolerance, cold hands and feet, needing extra layers. Constipation, slowed gut motility. Depression and low mood, thyroid hormone is essential for serotonin function. Brain fog and poor memory, cognitive slowing, difficulty concentrating. Dry skin and brittle nails. Hair loss or thinning, including the outer third of the eyebrows, a classic sign. Slow heart rate. Hoarse voice. Muscle weakness and aching. In older adults, hypothyroidism often presents atypically, with predominantly cognitive or cardiovascular symptoms rather than the classic textbook picture. This makes it even easier to miss. The most common cause is Hashimoto's thyroiditis, an autoimmune condition in which the immune system gradually destroys thyroid tissue. It is particularly common in women and tends to run in families. Treatment is straightforward, levothyroxine, a synthetic T4 hormone taken once daily in the morning. When the dose is properly calibrated, it restores normal thyroid function completely. Hyperthyroidism, excess thyroid hormone, produces the opposite picture, a revved-up metabolism that the body cannot sustain. Symptoms include unexplained weight loss despite normal or increased appetite, rapid or irregular heartbeat. Atrial fibrillation is a common and serious complication of untreated hyperthyroidism in older adults. Anxiety, nervousness, irritability, tremor in the hands, excessive sweating and heat intolerance, frequent bowel movements or diarrhea, difficulty sleeping, muscle weakness. In older adults, hyperthyroidism often presents with primarily cardiovascular symptoms, palpitations, atrial fibrillation, or heart failure with minimal classic symptoms. This is sometimes called apathetic hyperthyroidism. The elderly patient is not anxious or agitated, but rather tired and withdrawn. The most common cause is Graves' disease, an autoimmune condition causing the thyroid to overproduce hormone. Toxic nodular goiter, one or more overactive nodules, becomes more common with age. Certain medications, particularly amiodarone used for heart rhythm disorders, can induce hyperthyroidism. Treatment options include antithyroid medication, radioactive iodine therapy, and surgery. Between clearly normal and clearly abnormal thyroid function lies a gray zone, subclinical hypothyroidism and subclinical hyperthyroidism. Subclinical hypothyroidism is defined as a raised TSH with normal T4. The pituitary is working harder than usual to maintain output, but function remains adequate. It is present in approximately 10% of older adults. Whether treatment improves outcomes in this state is debated. Most guidelines recommend treatment when TSH exceeds 10, and consideration of treatment for lower levels in symptomatic patients or those with cardiovascular risk. Subclinical hyperthyroidism, suppressed TSH with normal T4, is associated with increased risk of atrial fibrillation, osteoporosis, and cardiovascular events in older adults and generally warrants treatment. The decision about treatment in subclinical states requires individual assessment by a doctor. Thyroid testing is simple, cheap, and widely available. The initial screening test is a TSH blood test, included in standard health screening panels or easily ordered individually. Who should be tested? Adults over 60, particularly women, should have routine thyroid screening. Anyone with symptoms suggestive of thyroid dysfunction. Anyone with a family history of thyroid disease. Anyone with known autoimmune conditions, such as type 1 diabetes, rheumatoid arthritis, or celiac disease, which increase thyroid disease risk. If TSH is abnormal, further testing including free T4, free T3, and thyroid antibodies will clarify the diagnosis. Thyroid dysfunction is one of the most common and most treatable conditions in older adults. The symptoms, fatigue, weight gain, cognitive fog, depression are real, significant, and correctable. If you recognize the signs described today, ask your doctor for a TSH test at your next appointment. It is a simple blood test that could explain years of unexplained symptoms and open the door to a straightforward treatment that genuinely restores quality of life. See you in the next video.